Hi all. So in this video we're going to continue with examination of motor system. So in the previous video we had already discussed about how to assess the bulk of the muscle, how to assess the tone of the muscle, and we also discussed about how to assess the power of the upper limb muscles. So in this video we'll be discussing about how to assess the power of the lower limb muscles and then coordination of movements, involuntary movements and gait. Reflexes have already been discussed as a separate video, so this would complete our examination of motor system. So first we'll see how we can assess the power of the muscles of trunk. So muscles of trunk means muscles of abdomen as well as the muscles of the back, the erector spinae. So first we'll see how to assess the muscles of abdomen. So in this case you can instruct the subject to attempt sitting up from supine position without using their hands. So basically you ask the subject to lie down first and then get up without using the hand. Okay. In this case, you can also apply resistance at the forehead because only then we can say it as a grade 5 because normal power is considered to be you doing the activity against the resistance applied by the examiner. So in this case, you can apply resistance over the forehead and ask the subject to sit up from the supine position. Okay. Now there is another sign here called the Beaver's sign. So what is Beaver's sign? Suppose there is a paralysis of the abdominal muscles. In that case, there will be displacement of the umbilicus when the patient attempts to lift their head from the pillow against resistance. So here you can see that the umbilicus is not central. Okay. So suppose it is the lower segment paralysis, then the umbilicus will move upwards. And whereas if it is an upper segment paralysis, the umbilicus will be pulled downwards. So this displacement of the umbilicus when the patient attempts to lift their head from the pillow against resistance is called Beaver's sign, and it occurs because there is a paralysis of the abdominal muscles. Now this is important because it is useful for localizing the level of spinal cord lesion, whether it is the upper segment paralysis or lower segment paralysis. Okay, so that is Beaver's sign. So next muscle of the trunk is the erector spinae and the muscles of the back. So to test the erector spinae, you can ask the subject to lie down in the prone position, and then the subject can attempt raising their head by extending the neck and the back. So here also you can apply resistance at the occiput level so as to say it is a normal part. So that would complete our erector spinae and muscles of back. Next, we've got the trapezius muscle that is also considered as a muscle of trunk. So to test for the trapezius muscle, you can instruct the person to shrug their shoulders against resistance while the examiner stands behind. So see here in this picture, the examiner is behind and he has kept his hand over the shoulders, and the subject is asked to shrug the shoulders. That means move the shoulder upwards while the examiner applies the resistance in the downward direction. So that is how you can test for trapezius. At an advanced level, you can actually test for the upper fibers. Actually, by this shrugging of shoulders, we are testing for the upper part of the trapezius. To test for the lower part of trapezius, you can ask the subject to approximate the shoulder blade. Now that's a bit advanced level. Those interested can test that also. But at least we should examine for the upper part of the trapezius. That is by asking the subject to shrug the shoulders against resistance. So now we move on to the muscles of the lower limb. So first group of muscles are the intrinsic muscles of the foot, but the problem is we can't assess it directly. It cannot easily be tested. But if there is a paralysis that can cause clawfoot, so on inspection if you can see a clawfoot, you can assume that there must be some paralysis of the intrinsic muscles of foot. Okay. Next group of muscle are the flexors and extensors of the toe and foot. So to do this test, you can ask the subject to dorsiflex or extend against resistance. So here in this picture, you can see that in the first case, the person is trying to do that plantar flexion. The person is trying to do a plantar flexion against the resistance that is applied by the examiner. And here the person is trying to do a dorsiflexion against the resistance applied by the examiner. So you ask the subject to do that movement, dorsiflex but against the resistance, plantar flexion but against the resistance, and remember you have to do it for both the limbs, right? So that will complete flexors and extensors of the toe and foot. So the next group of muscle is the extensors of the knee. So as I said in the previous video, here the basic concept is you ask the subject to do the function of the muscle. So if you're going to test for the extensors of the knee, you have to first keep the leg in the flexed position and then ask the subject to extend the knee. At that time, you'll apply resistance. Okay. So here first you ask the subject to bend the knee or flex the knee, and then you apply resistance over the shin of the subject's leg. See, on the shin of the subject's leg you apply resistance and then ask the subject to extend the knee against resistance. Okay, so if you know the basic concept of how we test the power, then this will be easy, otherwise it will be confusing. So here first flex the knee, apply resistance, and then ask the subject to extend it against resistance. Next group of muscle are the flexors of the knee. So in this case, we have to first extend the knee and then ask the subject to flex the knee against resistance. So you can first hold the leg like this. That means we have to raise the subject's leg from the bed. And when you raise the leg, you have to support the thigh as well as the ankle. So you have to hold the leg like this, and then you have to ask the subject to flex the knee joint against resistance. In fact, this picture has a slight, I would like to suggest slight modification for this picture. This hand should be somewhat downwards. The knee joint should be free. So you can support it at this thigh region and then ask the subject to flex it against resistance. So that is how you can test for the flexors of the knee. So the basic point is first you have to extend the knee or raise the knee, support it at the thigh and the ankle region, and then ask the subject to flex the knee against resistance. I always used to feel that these two tests are the most confusing ones because we tend to forget to raise the leg. Okay, so flexors of the knee, it is always easier to raise the leg and then do the test. Now next one is extensors of the hip joint. Now this is also a little confusing. So to test for the extensors of the hip joint, you can ask the subject to resist limb elevation. That means the examiner will try to pull the leg off the bed. Okay, here they can see that the examiner is trying to lift the leg off the bed, but the subject should resist that. Okay, so the examiner will try to lift the foot off the bed while the subject maintains the resistance. So see, here the examiner is trying to lift the leg, whereas the subject is going to resist it. So that is how we will test for extensors at the hip joint. Next, we've got the flexors of the hip joint. So it is going to be opposite of what we done before, right? So here, with the limb extended, you ask the subject to raise their leg off the bed against resistance. So here you ask the subject to raise the leg while you apply resistance. You are trying to push the leg back to the bed, but the subject is going to raise it against it. Okay, so that is how we'll test for flexors of the hip. So always try to recollect how we did flexors of the knee, extensors of the knee, extensors of the hip, and flexors of the hip. Okay, so don't get confused with these tests. Next, we've got adductors of hip. Now this is quite simple. Adduction means you're going to ask the subject to move the lower limb towards the midline. So you ask the subject to move the limb towards midline, but you will apply resistance. Okay, so see here, the subject is trying to move it to the midline, but you are trying to give the resistance. So basically we are trying to abduct it. So abduct the lower limb and instruct the subject to bring it back to the midline against resistance at the knee joint. So here you apply resistance at the knee joint and asking him to bring it back to the midline. So that will test adductors of the hip. For abductors of the hip, you do what? Just the opposite of the other. So here we first position the legs together and then we ask them to separate them against resistance at the knee. So here in this case, we ask the subject to move it away from the midline, but we will apply resistance against it. Subject want to separate the limb, but we will not allow it. So that is how we will test for abductors of the hip. Next, we've got rotators of the hip. So in this case, with the lower limb extended, we can ask the subject to roll the leg outwards and inwards against resistance. So here in this case, we ask the subject to roll the leg outwards or inwards against resistance. So that will complete examination of rotators. So that completed our assessing of power of the muscle. So far we've completed the bulk of the muscle, tone of the muscle, and power of the muscle. Now next heading is you have to test the motor part of cranial nerve. So you know there are certain cranial nerves that have got sensory part and motor part, sensory alone and motor alone. So here we are going to test the motor part of cranial nerves. So which are the cranial nerves that have got a motor part? We'll learn examination of cranial nerves separately, but in motor system examination we just have to know which are the cranial nerves that have the motor part and what to test. So in this case you have cranial nerves 3, 4, 6, which are primarily involved with movements of the eyeball. So you have to test for the movements of the eyeball. You look for strabismus, diplopia, nystagmus and ptosis. You have to check for the pupil as well as pupillary reflexes, which includes the light reflex, direct and indirect, and accommodation reflex. The next cranial nerve is trigeminal nerve, which has got a motor part, which includes the muscles of mastication, the temporalis, masseter, lateral and medial pterygoids. You have to check for jaw jerk and check for jaw deviation. The next cranial nerve with the motor part is a facial nerve. So we have to check for the corneal reflex, conjunctival reflex, and all other muscles that is innervated by the facial nerve. So you have to check for the wrinkling of forehead, closure of eyes, prominence of nasolabial fold, whistling, inflation of cheek, etc. Next, we have the vagus nerve. So you have to check for nasal regurgitation, nasal twang, dysphagia, deviation of uvula and hoarseness because your pharyngeal muscles are supplied by the vagus nerve. And then we have to check for the accessory nerve, which includes the testing of trapezius and sternocleidomastoid. And then we've got the hypoglossal nerve, which are primarily innervating the muscles of the tongue. So you have to check for the movement of tongue, part of the intrinsic muscles of tongue, check for any wasting, deviation, fasciculation or tremor. So that will complete our motor part of cranial nerves. So I'll be doing a separate video for cranial nerves wherein I'll be explaining how to do each of this. Okay, but this is a part of the motor system examination also. So now our next heading is coordination of movements. We have to test for coordination of movements separately for upper limb and lower limb. So we'll see what are the tests involved. So for upper limb coordination, the first test is called the finger nose test. So for the finger nose test, we have to hold the finger. The examiner should hold the finger in front of the subject. So this is the examiner's hand. And then you ask the subject to touch the target with the tip of their index finger and then touch their nose. So basically the subject has to touch the examiner's finger and then touch the tip of the nose. So the examiner can change the position of the target randomly. So you can move your finger randomly so that the person has to touch the examiner's finger at a different position each time. And one important thing is that we ask the subject to alternate between touching the nose and target as quickly as possible. It should not be slow, it should be as quickly as possible. Another important point is that we have to ensure that the subject extends and abducts their arm fully because we want to test for the coordination over the full range of movement. So basically, when you are keeping your finger, make sure that it is at a distance so that the subject has to abduct and extend his arm and then touch the finger and touch the nose. Okay, so you have to see that full range of movement to ensure that the coordination is normal or not. We have to observe for the speed, smoothness, range, direction and the force of movement because all this will be abnormal in case of cerebellar lesions. So that is the first test for coordination of movement, which is the finger nose test. So remember, the subject should touch the examiner's finger and touch the nose. Remember, the subject has to do it as quickly as possible and extend and abduct his arm fully. Okay. So the next test is the dysdiadochokinesis. We are checking for dysdiadochokinesis. So what is dysdiadochokinesis? It is the impaired ability to execute rapidly repeated movements and is observed in cerebellar lesions. So in this case, we actually ask the subject to rapidly supinate and pronate their flexed forearm. Okay, so basically here in this picture they are pronating and then in the next we are going to supinate it. So you ask the subject to rapidly supinate and pronate their flexed forearm. We are going to assess the speed and smoothness of the alternating movements. So normally individuals can perform this movement smoothly and quickly, but in cerebellar lesions, the person will not be able to do it smoothly. So these are the two tests for coordination of movement of upper limb, finger nose test and dysdiadochokinesis. In some books, we also have finger to finger test in which we ask the subject to extend the hand and touch the fingers of the subject but these two are the most common: finger nose test and dysdiadochokinesis. Next, we can test the coordination of the lower limbs. So the first test is called the straight line test. So this test is pretty straightforward. You ask a subject to walk on a straight line, placing one foot in front of the other. You can see that this is a straight line. You're asking the subject to walk, placing one foot in front of the other. Okay, so they have to walk forward and then return. So walk forward in this line and then return along this straight line. So if there is an abnormality or if there's a lack of coordination, there will be deviation to one side. The person will not be able to walk on a straight line. Okay. So the next test for coordination of movement of lower limb is the heel shin test. Heel shin test. So in this case, you can ask the subject to lie supine first, and then you ask them to raise the leg and place the heel of one leg on the opposite leg. Okay, here you can see that the subject is placing the heel of one leg on the opposite shin just below the knee. Okay, and then you ask them to slide the heel along the shin towards the ankle. So they have to slide the heel along the shin like this, and they have to repeat it 2 or 3 times. Okay, so here we're going to test whether the movement is smooth or not, whether the person can lift the leg, place it on the just below the knee joint here, and then slide it on the shin. So normally it should be smooth, rapid and precise. If there's an abnormality, the person will not be able to do this smoothly. Remember, you have to test on both legs. Okay, so that will complete coordination of movement of the lower limb. So there were two tests: straight line test and heel shin test. So after coordination, we have to check whether there are any involuntary movements. So what are the different involuntary movements that you have to check for? You have to check whether there are any tremor. So tremor can be of many types. There can be fine tremor, which is usually seen in thyrotoxicosis, resting tremor, which is seen in Parkinson's disease, and intention tremor, which is seen in cerebellar disease. So this is a diagram, picture showing tremor. So here you've got the intention tremor. So you have to check whether there's any tremor or not. Next involuntary movement that you have to check for is chorea. So what is chorea? Chorea is basically a involuntary dancing movement which can be due to many reasons. So it is a rapid involuntary dancing movement. One important cause is Huntington's chorea, which is the cause is usually familial. The next one is Sydenham's chorea, and the cause is rheumatic fever. So this is a picture showing Sydenham's chorea, which is usually due to rheumatic fever. You can see that there is a involuntary dancing movements. Next involuntary movement is ethetosis. What is ethetosis? It is continuous, slow, writhing movements. You can see that this movement here, this is called ethetosis and is usually seen in basal ganglia lesions. So the next involuntary movement is a metabolic flap. So as you can see in this picture, it is a regular abrupt movement of the outstretched hand and tongue. So you can see that there is this, when the hand is outstretched, the person is having this flap like movement. This is called the metabolic flap, and it is usually seen in hepatic failure, uremia and respiratory failure. So that completes the involuntary movement. So check whether there is any tremor, chorea, ethetosis and metabolic flap. Then you have to assess the gait of the person. So when you have to assess the gait, you have to first expose the lower limb fully and then ask the person to walk away from the examiner. So here you can see this is a type of waddling gait. So the person has to first move away from the examiner and then turn around and walk back to the examiner. Okay, remember they have to walk away first, turn around and come back to the examiner. So this is how we have to test for the gait. Check for whether there's any abnormal gait like Trendelenburg gait or high stepping gait or any other different gait, whether it's present or not. So thus, in examination of motor system, we have to first write about the bulk of the muscle, examine the tone of the muscle, power of the muscle. Reflexes has to be assessed, and then check for coordination, whether there are any involuntary movements and gait, and finally give the report. Okay, so I hope this video was useful for you. Thank you.